These facilities are a big boost in that children can now be taught how and why to stay clean. The program is targeting districts with not so good sanitation infrastructure, including Kisoro, Ibanda, Rukunjiri, Rakai, and Kamori. Here, schools have also received soap and hygiene education materials.
We help them sometimes to debate, sometimes to give some presentation like speeches. So the teachers train them. We give them motions. So every Fridays we have the best of these young classes. They can tell the importances of water. They can also tell the importances of fire, the importances of teachers and their parents.
Our government-aided primary schools would not charge school fees. Schools get capitation grants and may not be enough to have all those facilities in place. So for the soap, detergents, that is really very, very good for us. And I know we will reduce so many diseases that come as a result of poor sanitation and hygiene.
Despite this progress, challenges remain. Many schools still have broken toilets and poor waste management.
One of the safest ways to keep healthy is providing clean water, clean environment, and good nutrition. Those top three things can immediately eliminate 70% of all the illnesses.
We are much concerned with the school hygiene and sanitation, and we appreciate the work provided by the Dettol Hygiene Center. They have provided with us very many materials, hand-washing facilities in our schools, but not all the schools benefited. But 50 schools so far are on the program, whereas 30 schools have already benefited.
When we get dry seasons, there are some diseases which come in the dry season. When it becomes a very wet season, there are some diseases which are spread during the wet season, especially waterborne diseases, because there's a lot of increase in water. When we are like what we saw, flooding can contaminate the sewer lines. That water gets contaminated with our open wells and springs, and that means it's contaminating of drinking water.
Over 100,000 hygiene guidebooks have been distributed to learners and 5,000 to teachers to help reinforce daily hygiene practices.
We've already constructed 1,500 hand-washing facilities in the 750 schools. So each school will put 2 hand-washing facilities, one for the boys and one for the girls, that they can be able to practice good hygiene. And why we are doing this is because these are young children and we need to train them the advantages of washing hands, why it is good.
Still, the wider sanitation gap remains a national concern. Across sub-Saharan Africa, 779 million people lack basic sanitation and 839 million lack hygiene facilities. Experts urge governments, private partners, and communities to invest more in sanitation infrastructure.
With this will help them fight, first of all, fight diseases like diarrhea, typhoid, cholera, and also this will also help to improve their performance in school, because if they're not sick, they're going to be in school, they're not going to miss school, and then they'll be able to capture everything that's being taught to them, and this will help them perform well for themselves, learn a lot, and also on behalf of even the parent would be happy if their children are performing well without getting those diseases that are hygiene related.
As Uganda pushes for better school hygiene, lasting impact will depend on consistent funding, policy changes, and community engagement. Henry Okrut, UBC.